Alrighty, good morning. Thank you for joining us in our final snippet session of the week. Today, we'll be focusing on the toolkit document for certified managers and active managerial control. We presented the changes to the food code for the past several years. So during these quick snippets, we're really focusing discussion on the use of our accessory documents that we hope can both help explain the intent of the code section, but also help with implementation. We call the materials the AMC toolkit, but again, they are a set of recommendations to help. They're not required to necessarily be used. If a written plan is required, an operator may submit any format that works for their establishment and their local health department. So let's talk about how you can access the toolkits. They're available on our website at doh.wa.gov/food rules. There you're going to find 8 toolkit documents. We also have the materials translated into several languages, and we'll post those as soon as we have them verified. Today, we'll be highlighting the main toolkit of them all, active managerial control. For our entire rule revision, our entire goal in food safety is actually achieving active managerial control. It's really designed that you're preventive and you're looking for risks, identifying them and correcting them, and then preventing them from happening in the future. So again, our major focus in food safety is what we call AMC, or active managerial control. Now let's go back to the toolkits. So we designed the toolkit documents as a fillable form, so it could be printed out for writing your responses or completed electronically by typing in the fields. The fillable form is easy to use as is, but the blocks, the format kind of blocks changes to the main text of the form. But if you're savvy with Word, you can modify the document by customizing the ribbon of your Word document and adding the developer tab. And then once you're in developer, you can select restrict editing and then stop enforcing protections. There's no password needed. Again, we'll provide additional resources when the videos are posted to the web. So let's start with a little bit of history on the certified manager requirement. In 2006, a study evaluating the foodborne illness outbreaks in establishments identified that a certified food safety kitchen manager significantly reduced the risks for outbreaks in restaurants. The certified manager was actually the major distinguishing factor that separated restaurants that had outbreaks from restaurants that didn't have outbreaks. And then later that year, the CDC encouraged FDA to include the certified manager requirement in the food code. Prior to that, the manager was included in the food code, but it was an allowance to meet the demonstration of knowledge component. It was not actually required. However, in 2011, the FDA added the requirement for each food establishment to have at least one certified food protection manager. Now, this person didn't have to be on shift, they didn't have to be present, but each establishment had to have one on staff. Later, a couple of years later, recommendations to the FDA included the fact that the certified food protection manager was actually most beneficial when they were actually in the establishment. So in 2017, the food code actually required that the person in charge that was on shift have the certification. So it wasn't anymore that it was just one per establishment. It was actually one certified food protection manager per shift. So it had to be one of the persons in charge. Now, this was a large change and required, again, one certified food protection manager per shift. And when Washington went through the rule revision, we were looking to adopt the 2017 food code. So we were looking to adopt this pretty major change into our code. And we received quite a bit of concern from our statewide advisory group and many of our stakeholders that we work with about this provision. So we made quite a few modifications, and we worked on the modifications with our stakeholder group and with our partners. So let's talk about some of the changes that we made when we adopted the 2017 food code with the certified food protection manager requirement. One of the key ones is that we maintained the 2011-2013 version of the food code, which means that we require one certified food protection manager per establishment. So again, we did not require that it's of each person in charge. It doesn't have to be the person that's on shift. It just has to be one employee per establishment. So it's clear that it doesn't have to be one of the managers that's present inside the facility. I want to be clear also that we did adopt the section about it has to be one of the 6 nationally accredited programs, and we'll cover those in a moment. Okay, so that was one of the major changes. We also gave a staggered implementation. So our rule became effective in March of this year. However, the certified food protection manager requirement does not become a requirement until next year, so March 1 of 2023. We also gave a little bit of leeway if the business loses their certified food protection manager. We give them 60 days. So if you have a facility that their manager leaves employment or goes to a different job, then they would have 60 days then to replace their certified food protection manager. And again, for clarity, we do not require that the certified food protection manager be on premises. However, our certificate does. So it could be a copy of the certificate that they receive. However, that person does not need to be on the premises. And then we also wanted to make sure that we were clear about what the certified food protection manager does. They're responsible for ensuring persons in charge are trained, and then that written plans are available as required. So again, we didn't remove the food establishment from having all the knowledge. We just allowed the certified food protection manager to actually provide the training to the persons in charge. So maybe they don't have the certificate, but they should have that same level of knowledge. And then we added one more thing to our code that is unique from all the other codes in the United States. When we made the modification to the Certified Food Protection Manager, we actually also included the concept of active managerial control. Now, this has always been a cornerstone of food safety. It's always been in guidance. It's always been in the annex of the FDA Food Code. However, we actually codified it and required active managerial control of the one of the duties of the person in charge. So again, even if the person in charge doesn't have the certificate, the certified food manager should make sure that that person in charge actually has the needed level of skills, knowledge, and abilities to actually be able to be there when the certified manager is not. And again, active managerial control is a preventive approach. And so it's designed to make sure food safety risks are identified and then proactively controlled rather than a response to an inspection. And often risk factors that we see out in the field are a single or isolated incident. It's not necessarily something that happens over and over. It might have just been something that was just a temporary gap in a food safety standard. However, the full inspection will often reveal a potential gap in active managerial control where you keep repeatedly seeing gaps or multiple gaps. And so what we're really looking at whenever we're talking about managerial control is that we're going to look for pretty much three things to help us identify if we have a gap in that level of AMC or active managerial control. So the first one that we're going to look for is whether or not we have a gap with policies and procedures. Policies set expectations for employees, and then procedures how to explain how they're going to perform the task, make sure it's monitored and any corrective actions that are needed. So if a food establishment has good solid policies and procedures, their staff know what they're supposed to be doing, then we will evaluate the training and teaching. So we'll make sure that the managers and employees are trained on the policies and procedures and so that they can meet the expectation. Unfortunately, it's not just one-time shot. Usually they have to be coached and actually taught multiple times. So it's going to often need feedback and reinforcement. So whenever we're going into a facility and we see maybe they had an issue with maybe a temperature was out of control, or it wasn't cooked hot enough, or the cold holding unit wasn't cold enough, and so we'll ask them, okay, can you talk to me? Can you tell me how cold you're supposed to keep the foods? And if they say yes, 41 degrees, then we're like, okay, let's talk about your training, making sure staff are actually trained so that they can maintain it. And then the third one, if we've ruled out they have a policy, they train their staff, then the third one is going to be the level of monitoring and verification. And this is a supervisory role. So managers and supervisors need to make sure that they're verifying that employees follow policies and procedures and correct them when they see an incorrect procedure behavior. Again, repeated corrective actions often indicate a gap or in training or a need to refine the procedure or policy. So again, it's a little bit more of a performance standard. The Certified Food Protection Manager requirement is a certificate. They need to have that to show that they have passed the certification, so they have passed the exam. But the active managerial control component is a performance standard. We want to make sure that they are actually being preventive. They're looking for risks, identifying them, correcting them, and then controlling them in the future as well. And again, the key way that we'll look and evaluate if a facility has active managerial control is by trying to see if they have gaps in any of these, the policies, the training, or the monitoring. So let's kind of show you what that would look like if you're going through a facility. So let's say we're in a food establishment and we have all of these observations. We have workers unsure of symptoms of foodborne illness. We have a food worker that cooked hamburger to 148 degrees. We have a food worker that didn't wash hands after a break. We have a refrigerator that's operating at 47 degrees. We have hot foods that are cooled in the refrigerator in a 6-inch layer in a covered container. And we have an incomplete, inaccurate temperature logs. So if we were to see one of these items in a facility, we might be able to say, okay, wait, this seems like it might be a little bit of a one-off. But if we were to see each of these, we would probably indicate we have a pretty substantial lack of active managerial control. The person in charge is potentially not trained, not aware, or not having the proper monitoring and corrective actions. And then we would try to ferret it out and go, okay, let's talk about why did we observe some of this? So the first one, maybe we talk to the manager and we say, can you tell us about how you train or what your policy is for workers to know what symptoms are, they're too sick to work with food, or when do they have to stay home? And maybe they reply back, we rely on the food worker card program, or we don't, we just assume that they know. Okay, so that's going to be a gap for us, that you have a gap in policies and procedures, and that's where we should work with them to say, this is where you're going to need to make a change. All right, you potentially need to write a policy and procedure for employee health, because that's something that is a gap for you. The workers are not trained because you don't have a suitable policy and procedure. Let's say the next one is the food worker cooks the hamburger to 148, and we ask the manager, can you tell me how hot workers are supposed to cook ground beef? And they say 158 degrees. And we're like, okay, you've got a policy procedure. It doesn't have to be written. It can be verbal. Can you tell me how you train them? Yes, we walk them through. We show them how to use a thermometer. We have them, do all this work. And then when we go through, and we're like, how often do you actually go and you check to make sure they're working and holding that standard? They're like, never. Like, okay, that's where your gap is. And so in this case, some of the corrective actions would actually be directed toward the manager to make sure that they are observing the practices, and potentially that in this case, they could say you could be required to use a temperature log for a short amount of time to make sure that you are monitoring this and get into that habit. Similar with a food worker that doesn't wash hands after taking a break. Traditionally, the vast majority of people know they're supposed to wash their hands before they return to the kitchen, so it's probably not a policy issue. And it's difficult to really monitor for this and correct it. So it's probably a training and coaching, something that needs to be constantly reminded, brought up again. You can't generally tell somebody they need to wash their hands one time. It's something that you have to continually train on and make sure that you're reinforcing that requirement, that standard. Refrigeration at 47 degrees, they probably recognize it's they're supposed to be 41 degrees or colder. It's been a pretty common requirement for a long time. They probably understand that they train staff to put stuff in the refrigerator. This one's probably a monitoring kind of situation. So make sure that they are actually actively looking at temperatures, not just putting things in the refrigerator. Similar with the 6-inch layer of covered container for cooling. You talk to the worker and say, or talk to the manager and say, tell me how you train your workers on how to cool foods. And they say, yes, we cool it on the counter and then we put it immediately, once it's cooled down a little bit, into the refrigerator. So that's going to be, we have a gap here with the policy and procedure. So even the training wouldn't fix it, and neither would the active monitoring, because at this point, the policy and procedure are incorrect. So we would need to correct it there. And then finally, inaccurate temp logs are traditionally going to be a monitoring issue. So this is the other part of it. We're not trying to get everyone just to use temperature logs or record things if it's not going to support their work. So sometimes we'll go in and the temperature logs or any logs that they maintain routinely aren't fully completed, or they're inaccurate, or they're completed before the day is even really started. So again, you really want to make sure that they're using those as tools to help them evaluate their policies and procedures and the way staff are following it to make sure that system is working for them. Again, I just wanted to highlight those concepts because this is our end goal. This is our whole desire to get active managerial control. So now let's move on to the toolkit. All right, now this one's one of our wordiest toolkits we have. We've combined both the AMC basics and the Certified Food Protection Manager requirements onto one toolkit. It's really designed to make sure everyone knows that a certificate is required, but ultimately what we're really trying to gather is the level of active managerial control. That is our key performance measure as well. So we've included a list of common procedures in section 2. We've talked about this a little bit on an earlier snippet, but there are a lot of procedures that are done in food establishments. And even if you're not required to have a written policy or a written plan on how to do it, we do encourage food establishments to evaluate each of these procedures. Again, they're commonly used in food establishments, and unfortunately, they're commonly found to be causes of foodborne illness if they're done incorrectly. So health and hygiene, all about hand washing, utensil uses, temperature control, obviously using a thermometer, cooking to proper temperatures, hot and cold holding, date marking also is included in here. And then contamination prevention. So things like washing produce, keeping raw meat separate. So again, these are key components of running any food establishment. So you want to make sure if you're evaluating yourself as a manager that you could make sure that each of your staff know the proper ways to do each of these items. You can add on to it as well. Again, we talked about that you can modify this document, but this is a good starting place for most food establishments. Now, section 3, we highlighted the written procedures that are required. So again, remember that the certified food protection manager is required to make sure that the persons in charge are trained, but that they also have all of these written required materials. So again, this would be a major task for some of the certified food protection managers if the business provides any of these processes or procedures. And then finally, this is probably one of the most popular sections, is the establishments that are exempt from the certified food protection manager requirement. So the code allows for or requires every food establishment to have a certified food protection manager unless they're what is considered a low risk food establishment. So they have a low risk of transmission of a foodborne illness. Traditionally, this is going to be because they have limited food handling. They might have a low volume of food, or maybe their population served are not at high risk. So again, these would be types of facilities that would be exempt from the certified food protection manager requirement. You'll notice though, when I highlighted this section, I also highlighted the top one about be sure with working with your local health jurisdiction, because the regulatory authority is the agency, not the code, and not Department of Health, but the regulatory authority that issues the permit is the agency that actually determines which establishments inside their district are going to be considered exempt from the certified food protection manager requirement. Know that we tried to provide some guidance here, and we did work with our partners to make sure this matched the majority of their expectations as well. So let's kind of highlight some of the establishments that would be considered low risk and exempt from the certified food protection manager requirement. First one is they serve or sell only prepackaged foods. So this would be like packaged gallons of milk in a convenience store. It could include, frozen ice cream bars, things that do require refrigeration, but they're actually still packaged. So maybe bags of lettuce mix, they're commercially packaged and they're just stored inside of the refrigerated case. Maybe it's a facility that prepares non-TCS foods. So these, again, TCS foods are the foods that require temperature control, hot or cold, to keep them safe. So some facilities that prepare foods, but they're not really temperature sensitive, are cinnamon rolls, candy, donuts, pretzels, blended syrup kind of drinks. Maybe it's a food establishment that heats only commercially processed, ready-to-eat foods. So this would be a lot of our coffee shops that have like a latte where they have to keep the milk cold, but then they just heat it for service. They're not really cooking from raw state. They might even hot hold TCS foods like hot dogs. So again, that goes back to our example of a convenience store maybe that has a roller with hot dogs on it. That would traditionally be considered a low-risk food establishment. Or maybe they serve food on an infrequent temporary basis at short-term events. And so this would be like a temporary event at a fair and festival. Again, all of these facilities need to have a food worker card, the basic food safety handling card that we require in Washington, but they would traditionally not be required to have the additional manager certificate. Any questions along there? Feel free to include them into the chat if you have them, but otherwise I will go on to page 2. So on page 2, we highlight the key duties of the Certified Food Protection Manager. Again, we really want to emphasize it's not the fact, even when they did the studies about seeing that the Certified Food Protection Manager actually reduced the potential for foodborne illness outbreaks, it wasn't so much that it was the manager that did it. It was because they had the knowledge and they actually implemented the procedures to make sure that, in this case, primarily, it was that ill workers didn't come into the food establishment to work. So we really want to emphasize it's not the certificate that is actually the key component. It's required, but it's not the key component. What is key is that you take that knowledge and you actually translate it and implement it in the food facility. So we wanted to highlight in section 5 some of the key components to remind everyone, yes, you have to have the certificate. Also, it does not replace the actual food worker card. They work in tandem, but one does not replace the other. Want to make sure the certified manager knows they have to have any required procedures and plans, such as the vomit and diarrhea cleanup, are current and implemented. They also need to make sure that the person in charge is trained. So we listed here some of the key components of the level of knowledge that are required for a person in charge. we didn't list them all, but we pulled out a few, but we did give the code reference. So if you want to look them up, it's WAC 246 215 02105. But again, those are the level of knowledge that are required and expected for each person in charge. And then the next section that we included were the duties that the person in charge is supposed to have. So again, we were trying to highlight each of the key components to make sure that the Certified Food Protection Manager understands it's not just to have the certificate, but they actually have a duty to make sure that each of these items are actually covered and working inside that food facility. Okay, so let's look at section 6, where we've identified each of the 6 nationally accredited certification programs. You'll also see in the header, we have the link to the actual certifying agency. It's ANSI approved. And we would encourage everyone to actually go to the link. You can use our document. We will try to keep it up to date. However, especially I think as more and more states adopt this requirement, I think we're going to find more and more providers of the certification. So we encourage everyone to look at that link to actually find all of the current ones. For example, we've had 6 certifiers for quite a few years. However, they've changed. We had one certifier that is no longer doing the program, and we have a new one that actually was just approved a few months ago. So again, we really want to encourage everyone to keep looking at the main certifying source, but you can also use this as a resource. And again, we will try to keep it as up to date as possible. What we tried to do here is we identified the company name. Each of those are hyperlinked. So if you're looking at it electronically, you'll be able to link to the company. Also, whether or not they provided training online or in person, if they had a manual, what kind of training they had available, also what languages. You'll notice when you look at the list, it's very limited in the languages, which is one of the reasons why we made so many modifications to when we adopted this section into Washington. However, we do have several of the programs allow maybe a translator or an interpreter to actually assist people that need to have another language if it's not available by the certifier provider. We also identified testing options. So traditionally before COVID, especially, they were always in person or at a local testing center, but the vast majority of them now have potentially an online proctor. So there are additional options for people to actually get certified. Still pretty intensive. The test is usually 2 hours. It's about 80 questions. You do your own self-study, or sometimes you can do a training program. It's up to you. It's also potentially expensive. So sometimes the test alone can be anywhere between, say, $20 to $50 to $60. And then also depending on how you have it proctored, because again, it's a certified exam, so you have to make sure it has a proctor. It could also cost additional if you have to have an in-person proctor or your connection with your internet. So again, it does take quite a bit of time and energy to become certified. And again, this is a pretty common feature around the US, and a lot of states are adopting it. The vast majority have the same adoption as Washington has, so where it has to be 1 per establishment. However, states that are adopting the newer version of the code are going to require that it's 1 per shift. All right, and then finally, on section 7, we remind the operator about maintaining the Certified Food Protection Manager requirement. So again, it's really designed to make sure that they renew the certificate. The certificate is valid for 5 years. Make sure that they're monitoring procedures and staff training to maintain food safety requirements in the facility, and then have the copy of the certificate available. So, and then they need to replace that every 60 or within 60 days if the person leaves. So again, what we're trying to do is make sure that we have active managerial control inside of the food facility. It's really been shown that to reduce the risk factors actually associated with foodborne illness outbreaks. And if you came to Milei's session yesterday about the foodborne illness outbreaks, a lot of those outbreaks, sometimes it's contaminated food, which is very difficult to control. We can reduce the impact by identifying foodborne illnesses and then pulling a product off of the retail. But the vast majority of illnesses and outbreaks that we have are actually linked to improper practice in a food facility. And so the Certified Food Protection Manager can help reduce those risk factors. Each food facility, again, must have at least 1 employee with a Certified Food Protection Manager certificate. Again, it's going to be determined by the regulatory authority. And then the sharing the certificate is between establishments is actually acceptable. Our code does not require or cap how many businesses a certified food protection manager can work with. What it's capped by is a performance standard. Each establishment that is served actually has to be able to maintain that active managerial control. So some food facilities might need a manager there on premises because they have high demands. Others may respond well to having multiple locations with one certified manager because they all do very similar work and they can kind of leverage their resources that way. And again, we really want to encourage active managerial control here. So the way we're going to evaluate that is by looking at policies and procedures. So if you're a business and you try to identify if you see a food safety gap through self-inspection or through your inspection history with your local health department, you'll potentially be able to say, okay, wait a second, why did we have these gaps? Was it a policy and procedure? Was it training and coaching of staff? Or is it because we're not maintaining monitoring and correction by management? And again, our whole goal is to actually be proactive and correct issues that we identify before potentially it turns into a foodborne illness or before it turns into a continuation and growth of additional risks where we identify we have a gap with active managerial control. All right, want to emphasize also that all of these resources are available on our website. We are continuing to work on additional toolkits to support the routine kind of items that we've discussed. So the hand washing, we talked quite a bit yesterday also about hygiene, things that, you know, our toolkit is more specific to employee health. However, we are going to also work on one for hygiene. So that's about hand washing. And we talked about the artificial nails. We also have some in there for cooling because that's a frequent item that we see as potential risk factors inside a food facility. So we'll continue to work on additional toolkits. We hope that this is a good pattern to get you started. Again, we encourage you to use them. If you have any suggestions or additional items that you think we could add, we would be happy to do that as well. And again, we really want to emphasize and thank you very much for attending our sessions. We've really enjoyed working with all of you day in and day out, but then also seeing you in the sessions and hearing some of your questions. And some of the discussion that we've had has been really, really fun for us. You know, it's been hard since we don't get to meet everybody in person these days. So we've really enjoyed the sessions and hope that you've gotten a lot of benefit out of them as well. We do encourage you to reach out to us. You can use our general email. We all respond to it. It's food.safety@doh.wa.gov. You can also subscribe to our, we have two Gov delivery kind of listservs. One is for recalls, the other is for food code updates. So we hope that you'll register for those. And again, Cindy will connect with you again once we have the final notes drafted and ready to go, once the videos have been closed captioned and they're posted, and then also when we have all of the FAQs. So we will make sure that we get those added in as well. And then you'll be notified through email when those are available. So again, we appreciate everyone registering because that gives us your email address, and so you'll hear directly from Cindy. Okay, so I see we do have actually, let me go ahead and we can answer some of the questions in the FAQ. So let's go ahead and sign off the video. Thank you again, everybody.